My name's Dr. Sarah Jarvis and I've been a GP for rather more years than I care to remember, nearly 25 to be precise. And during that time it has astonished me, first of all, how many women suffer from sensitive bladder, and secondly, how difficult they find it. They may well have taken years and suffered in silence before they come and get help.
My name's Elaine Miller and I've had sensitive bladder for about 8 years.
I'm Emma Robertson. I've been suffering from bladder weakness for 2.5 years now.
My name's Hannah. I'm 34 years old and I've just had a baby boy.
My name is Helen Watts and I've suffered with bladder issues for the last 24 years.
I first noticed that I had sensitive bladder after the birth of my first baby. At its worst, I was having accidents, like frank accidents, maybe 2 or 3 times a week.
If I've got a bit of a cough or I've got a cold, then I'll have a lot of problems. But I don't play as much as I used to. I do worry about having accidents when I'm out with them.
For a long time I felt that I had the potential to grow into being a smelly old lady. It's quite embarrassing completely wetting yourself.
There's very little warning to prepare to go to a toilet. I have been caught out in a supermarket, in a restaurant. I've literally had to go to the nearest charity shop to buy a set of clothes that I could change into.
Having a sensitive bladder has affected the way that I dress. I like to wear baggier tops to cover all that area in case I have an accident and to make me feel more comfortable without people being able to see anything. It's affected my self-esteem and my confidence a lot. You worry that you smell sometimes. You can smell it yourself, but I don't think the smell's really there.
I was in the supermarket and they don't let you use their toilets. And I literally had a loaf of bread in one hand, Nathan in the other, and I went up to the woman and I was like, if you don't get me to the toilet now, I'm going to wee in aisle 3.
I found the products on the market not so accessible to me at the time. Had I found the appropriate products, I think my journey might have been quite different.
I'm pleased to see that always Discreet products come to market because they are much thinner than anything else that I've tried before, and I have tried them all.
It's comfortable and flat. I can move around more comfortably.
And the other thing is that they don't smell. Because it's got this odour lock, then that takes care of that worry.
And also it was aesthetically pleasing on the shelf, so when you pick it up, people don't automatically go, ooh.
Incontinence is such a common problem, there's no need for it to be a taboo. I think I have now become the woman who doesn't stop talking about incontinence.
There are lots of things that women can do for sensitive bladder. Here are my top tips. Exercise is so important. There are lots of kinds of exercise that don't put a lot of pressure on your pelvic floor but can really help your general level of fitness, which will also help you keep your weight down. Things like cycling, brisk walking, swimming, yoga, all of those are fantastic. You need to do pelvic floor exercises really regularly, certainly 3 times a day in the long term, but we would often say 10 times a day, just for a few minutes in the short term. And it will take 2 or 3 months, but it really will make a difference. We estimate that in up to 80% of cases, you can either significantly improve things or possibly even cure your problem. If you don't drink enough, then A, your bladder gets used to dealing with less, and that means it can't cope with as much, and B, the urine is more concentrated, and that can irritate your bladder. If you do want some more information online, you can always log on to alwaysdiscreet.co.uk.